Okay, a process isn't complete without a number of committees. So I'll just go through three, I guess, are up and running and functioning, and the fourth one, again, will be determined to a large extent by the activities of today and tomorrow. The First Nations Health Council, that was established in '07, and certainly that council has been providing leadership throughout this whole process of working through the tripartite health agreement, and again, engaging themselves and the other partners into meaningful discussions throughout those number of years. In April 2009, the First Nations Health Council actually incorporated the First Nations Health Society to act as the business and operational arm for the Health Council. The Provincial Advisory Committee on First Nations Health, I wish we could come up with a shorter title, is really a group that gets together annually or twice a year, we're trying to. And it's a committee that involves the First Nations Health Council, the Ministry of Health Services, represented by the Deputy Minister, the Ministry of Healthy Living and Sport, again represented by the Deputy Minister, all of our CEOs of our health authorities, so the 6 CEOs who manage the provincial health authorities come together with the deputies of both ministries and the First Nations Health Council. Also included in that group is Evan Adams, the Aboriginal Physician Advisor to the Provincial Health Officer. It's an opportunity to sit down periodically and really discuss progress and the service plans of all of the organizations. How do the service plans of the health authorities and the service plans of First Nations communities, how do they come together and report progress? In all of my career, and as somebody said, I've got many years within the provincial service, some in Saskatchewan and many years here. That's the first time in my recollection where the senior leadership of First Nations and the senior leadership of the provincial health system actually come together in a meaningful way and have a discussion about goals and objectives and how they're going to work together. The Association of Health Directors, again, day 3 of this forum is going to focus on that. But we thought it would be important to bring health directors from First Nations and bring them together as an association so they could periodically spend some time, share ideas, learn from each other, and actually coalesce as a group of healthcare professionals with a particular expertise in providing those services to First Nations communities.
All right, thanks. The Tripartite First Nations Health Plan committed the partners to develop this new administrative structure, some call a new governance structure, that would provide greater control by First Nations for First Nations. And in order to get that job done, we've created another group that's working on this, the BC Tripartite Governance Committee. And you can see it's represented by representatives from the BC Ministry of Healthy Living and Sport, from Health Canada, and from the First Nations Health Council. The 3 co-chairs for the First Nations, Grand Chief Edward John, Grand Chief Doug Kelly, and Chief Shane Godfredson, are assisted by the First Nations Interim Health Governance Committee and regional representatives, many of them who are here today, and you can speak to them as we go. So I'll turn this over to Doug.
The First Nations Health Governing Body, again, which is kind of now being called the First Nations Health Authority, is the body that we're talking about here. Is it possible to create such a First Nations governing body to actually manage and direct those services that are currently provided on behalf of or through Health Canada through First Nations Inuit Health Branch? So that's an important piece to keep in mind, and there will be lots more time over the next couple of days to discuss what would that look like, how do we implement it, and how do we get an agreement in principle that would describe what that body does and what authorities and responsibilities it would have. And I think I'm now turning it over to Ian.